Hello friends, good evening once again. Today we are going to discuss about the collarbone clavicle. Already have discussed about the clavicle. Now we are going to see what is the commonest site of the fractures of the clavicle. Let us discuss about it. Before going to explore, please subscribe to my channel. Now we are seeing the clavicle superior view. Now we can find this is the left-sided clavicle and this is your left-sided scapula. Now we are going to see the clavicle superior view and the scapula superior view. Now the commonest site of the fracture of the clavicle is the two parts which we know that is medial 2/3 and lateral 1/3. So the junction between medial 2/3 and the lateral 1/3 is the commonest site of the fracture of the clavicle. And this is the clavicle inferior view. Now here you can see the subclavian groove and here you can see the conoid tubercle, and this is nothing but your medial 2/3 part and this is nothing but your lateral 1/3 part. The junction between these two parts, this is the commonest site for the fractures of the clavicle. Now, why this junction is the commonest site for the fractures of the clavicle is, though when you fall on your outstretched hand, suppose if a person is traveling on a bike or a motorcycle, suddenly if anything comes in front of him, if he applied sudden brake, it may undergo skidding and he may fall down on his outstretched hand. The muscle which is present in the neck, that is sternocleidomastoid muscle. As you all know that this sternocleidomastoid muscle, it is having two heads. One is clavicular head, another one is sternal head. So this sternocleidomastoid muscle, it pulls the medial 2/3 part upwards. Let us see the sternocleidomastoid muscle. So this is how the sternocleidomastoid muscle is present. Here you can identify the clavicular fibers. When a person falls on his outstretched hand on his shoulder, so this sternocleidomastoid muscle pulls the medial 2/3 of the clavicle above. So the lateral fragment, lateral 1/3 part, it after fracture it goes below, and medial 2/3 part it comes above. So there may be, how what we can see is the smooth encounter we could not see in the fractures of the clavicle, and we can also see an elevation at the junction of medial 2/3 and the lateral 1/3. That says that fracture is present. Now, what are the complications can be seen? As we are seeing a vein in the deltopectoral groove, that is cephalic vein. During these fractures, the fractured bony endings, they may rupture this cephalic vein, and as we knew that the subclavian vessels which are exactly present underneath this clavicle, so the fractured bony part which may rupture the subclavian vessels also. So that is about the clinical aspect and the fracture cases and the commonest site of the fracture of the clavicle. Yes, during clavicle fractures, the device which we use is the clavicle brace. So for what it is used to immobilize or stabilize the clavicle, usually the following fractures or the injuries. So the mechanism of this clavicle brace is three things. One is posture correction, immobilization, and support. So the posture correction, the brace, it pulls the shoulders back. Here you can see that when the brace is applied, both shoulders are pulled back so that it is aligning the both clavicles and preventing further displacement. That is for posture correction. Then second thing is immobilization. By restricting shoulder and upper back movements, it reduces stress on the clavicle, the fractured clavicle, and it is aiding in proper healing. The third thing is support, maintains the clavicle in a neutral position, minimizing pain and promoting the bone alignment. But the thing is, it is not suitable for all the clavicle fractures. It is not suitable for all clavicle fractures. So, if example severe displacement, if both ends were severely fractured or multiple fracture is present, but this is not helpful in the severe displacement. And prolonged use can lead to muscle weakness also if not combined with the rehabilitation. So just for the hairline fractures and the minimal fractures, this clavicle brace can be used under the guidance of the orthopedic surgeon. Thank you. See you soon in the new class.